Welcome to my channel. In the 1600s, doctors diagnosed patients by tasting their pee. Pee-lease say that's not true. It's true. So doctors would take a sample of a patient's urine, boil it down, and then drink it to see what it tasted like. They believed that the taste of the urine revealed the presence of certain diseases. For example, sweet urine meant that the patient had diabetes. Doctors also believed that the smell of the urine could tell you a lot about a person's health. So they would have patients sniff their own urine to see if they could detect any unusual odors. If the urine smelled like acetone, for example, the doctors would know that the patient had diabetes. But how did this all start? Well, in the early days of medicine, there was no way to test for diseases other than by observing a person's symptoms and then guessing what was wrong with them. This led to some pretty gross methods of diagnosis, such as tasting a patient's urine. But as science progressed, we eventually figured out that this was a bad idea. Today, we have much more sophisticated ways of diagnosing diseases. We can run tests on a patient's blood or urine to identify the presence of certain chemicals or substances that indicate a particular disease. This is much more accurate than relying on a doctor's sense of taste or smell. Plus, it's a lot less gross. Still, this is just one example of how medical science has come a long way since the days when doctors were drinking patients' pee. Today, we have advanced technology and equipment that allows us to diagnose diseases in ways that are much more accurate and less invasive than ever before. Who knows? Maybe one day we'll be able to cure diseases by tasting urine again. Just kidding. Let's not bring that back. Thanks for watching. Comment below if that ruined your day. And don't forget to subscribe so you never miss an episode.